My name is Darin Kistler. I am the Senior Director of Radiation Services at the University of Kansas Cancer Center, located in Kansas City, Kansas, in the United States of America. The University of Kansas is an NCI-designated comprehensive cancer center, and we had a very robust radiation oncology program, which included external beam therapies and brachytherapies. But one of the areas that we felt that we were really lacking on was a particle beam treatment. As an academic medical center, we are a teaching and training facility. We treat a lot of pediatric patients, and so proton therapy was really a very natural decision for us to progress into treatment modality to make sure that we could provide all kinds of radiation oncology treatments to the patients that we serve. There are many benefits to proton therapy for an institution to take up. Number one, it's always been about the patients. It's being able to offer a better treatment modality for the patients that we serve. There are a lot of other tangible benefits to proton therapy. I think in one of the areas that it's from a recruitment standpoint and retention, I think as an educational program, when we think about our physician residency programs, our medical physics residency programs, our therapy training programs and medical dosimetry training programs, having proton therapy, I think it's a career ladder for many of our people. So I think that's been one of the positive benefits that proton therapy offering. I think there are many others, just what we would call, maybe consider the halo impact of proton therapy, above and beyond our staffing model. Our patients tend to travel much further for proton therapy. In fact, about 40% of our patients travel greater than 50 miles for the treatment modality. All of the key metrics of a radiation oncology center have grown. So when we look at patients, they may not all be the perfect candidates for proton therapy, but those patients also stay at our institution for other types of treatments. We've seen growth in things such as our brachytherapy program after we begin offering proton therapy. So I think there's absolutely a halo impact. I think about the other side of the equation, the cost of not having proton therapy. There are many factors that I think you must consider when selecting a proton therapy unit. One of the major factors for me was proton therapy is very much of a relationship. It is a piece of technology that should be with you for many years. It's a piece of technology that must grow as the treatment evolves. So I wanted to be really focused on a proton therapy provider that has been around, that's been very established, that has a proven track record of providing exceptional care. It's a partnership. So because it's a long partnership, I wanted someone that would be there 30 years down the road with me. I think the other thing, and I'm less experienced on, but really is about the particle itself, the spot size, and really from a medical physics standpoint, we had a team that was evaluating the different proton systems out there, and we wanted to have the best system for the patients that we serve. And if you put the patient in the center of all your decisions, you'll always make the right decision.